us on all that has to do with our health. And this we're going to be discussing on health and wellness under that, which is prostate cancer, and apparently we're going to be discussing on what it is, how to deal with it, and how to go about the treatment, and so many other things that we're going to be discussing about. I am Bukola Balogo, and I have over the phone with me doing this with me Dr. Abiola Ajayi. He is the MD CEO, ROA Specialist Hospital. Good morning, doctor.
Good morning.
How are you doing?
I'm doing well. Thanks for having me.
All right, it's good to have you. Well. Yes. Before lines will be open shortly for you to make your contributions on the topic of discuss this morning. But yes, we're going to be starting off with what exactly prostate cancer is. Doctor.
Yes, first of all, if those listening to not know what the prostate is, the prostate is a gland that's only found in men that's responsible for semen. So when the man ejaculates that whitish fluid, 95% of that fluid is from the prostate, and it's a small gland about the size of we always use food items in medicine to describe things. So this one is the size of a walnut. It sits right below the bladder, between the bladder and the penis. So now, if you have cancer in that gland, we now call it prostate cancer.
Okay.
And the reason why we're talking about it, I tend to talk about it often, is because it's the number 2 cause of death in men. It's the number 1 cancer in men, and in some areas, it is now becoming the number 1 cause of death in men. So it is extremely important. In some areas in the world, they've gotten a handle on it and shown reduction, and in some areas of the world, like Nigeria, we're falling a little bit behind. So it's extremely important to talk about.
All right, thank you very much for that. But I would like to know, are there different types, or let's talk a little on the stages of prostate cancer?
Yeah, types and stages are different. When we talk about types, 99% of prostate cancer is something called adenocarcinoma, and that just means that it's like I said, it's a gland that secretes a fluid. So once you have cancer of the gland, that's an adenocarcinoma. You can have other different types, but you rarely see them. I say rarely, I mean less than 1%. Those are sarcomas, small cell carcinomas, and transitional cell carcinomas. In the prostate, you see them very rarely. So it's typically adenocarcinoma. And when we're trying to look for prostate cancer, we do a biopsy, and the biopsy will come back and say adenocarcinoma, meaning cancer of the gland. And then we'll now start talking about different stages. And when we talk about stages, that's really talking about spread. Is it involving a portion of the prostate, one side of it? Is it involving the entire prostate? Has it moved outside of the prostate to nearby organs and tissue, or has it gone distant? Meaning sometimes prostate cancer can spread to the bones of the back and the pelvis, and even to the lungs and the chest.
Okay.
So it can range anywhere from local disease to what we call metastatic disease.
All right. Thank you very much for enlightening us on that. But yes, if you have any question for the doctor, you can call 07000 917 917 and you address it. Or you can send in a WhatsApp or a text message to 070 317 56537, and Dr. Abiola Ajayi will be able to address whatever health challenge that you might have this morning. And I have this text message. It says, good morning, doctor. Please, what could be the cause of stomach noise at the time, all the time, for a long time now? Any remedy? Linda from Lagos.
they said stomach pain.
No, rumbling. Okay, noise.
Stomach
Let me
rumbling.
say noise. Yeah.
Okay, stomach noise. Okay, yeah, there's a long term for that called borborygmy, and it really just means that stomach rumbling, and usually it's from excess acid production,
Okay.
and usually those people will have flatulence, meaning passing gas. They may have belching, and it all starts from excessive acid or unbuffered acid. We talked about it last time when we talked about peptic ulcer disease. Those people also have excessive acid production, and you can now have a lot of rumbling. That's usually what happens in an adult, and you can easily tell that when you ask the patient when you start eating. Usually the rumbling goes down when your belly is full. And then there are different tests that you can do in the hospital or in the clinic to be sure. But that's typically what causes it.
Mm.
If it's left untreated, this can actually progress into the peptic ulcer disease, like we talked about.
Okay. Thank you very much. Hello. Good morning.
Hello, good morning.
Good morning. What's your name and where are you calling from?
Oh, I'm Boniface Banan, calling from Ogudu.
All right. Your question for the doctor.
Doctor, good morning.
Good morning.
Oh, I'm sorry, my question is not really based on today's topic.
Yes. Go ahead.
Okay, my girlfriend is having this problem. Before, she normally have a period normal, but recently she started observing this issue. If her period menstrual start overflowing of this thing, of period, like we had the instead of like 3, 4, 5 days, she had it like 2 weeks, 3 weeks, but she didn't feel any pain at all. So I don't know what could have been because she had been observing many tests like this day, but they finally told her to go and run tests for her immunes or whatever. But I'm confused because when she run the test that she run the other time, they said that she have no issue in her womb. But I don't know what could have been because of long time flowing of menses.
Okay.
So,
Yes, doctor.
And how old is she?
How old is she?
okay, she is 25 now.
Okay.
Okay. Because you helped me fill in some of the
All right.
gaps because it was going in and out.
No problem.
But is
Just
that,
want to listen over the
All
radio.
right.
I will listen over the radio.
All right. So I think his complaint is her period now lasts longer than it used to, but she doesn't have pain. She has gone to the hospital for tests. Initially, they said there was nothing wrong, but then she was told to go for a test that it could be an hormonal imbalance, and I think that is what they have been doing for now. But the flow is still excessive, and they don't know what the cause is.
Okay. When you're talking about menstrual flow, a woman can have a lack of flow completely, which doesn't sound like this person has. You can have something called oligomenorrhea, which means that the flow is infrequent. Because normal menstrual flow is it averages about 28 days, every 28 days, but you can see it from anywhere from 21 to 35 days, and a few different things that can cause your menstrual cycle to change can be stress and lifestyle. We've talked about it before. Stress meaning psychological, emotional stress at work. Those over time, it's documented that they can cause issues, as well as gaining a significant amount of weight or losing a lot of weight. Going on a diet, on a very radical diet, even excessive exercise, all of those, anything that really interrupts a woman's routine can cause change in the menstrual cycle. Then, of course, medications, especially birth control pills. And there's a lot of time people use what we call the morning after pill. And they're not afraid, they're not aware that actually can throw off your cycle.
Okay.
And they use it routinely as a form of family planning and birth control, which is not. Is meant for emergencies, but it can also cause your periods to be irregular or missed. And these drugs can cause changes for up to 6 months. So, and then after that, we now start talking about fibroids, endometriosis, adenomyosis, and infections. Of course, I just talk in general terms because I'm not with this patient. But if I were to see this patient, these are the things that we would look for. And then of course we would do hormonal tests. When you do hormone tests, you have to do them at specific times of the menstrual cycle, and even specific times of the day for some of them. So otherwise, your results will not be valid. So we do all of that over the course of a month, and then should be able to give a much clearer picture as to why the menstrual cycle is changing.
Okay. Thank you very much, Dr. Ajayi. And it's still Radio Doctor, your free health consultation program where real doctors advise real people. And yes, I've been speaking with Dr. Abiola Ajayi. He is the MD CEO, RA Specialist Hospital. If you want to reach him outside of the studio, you can call him on 0705 919 2017. But he's presently over the phone with us in the studio. You can call 07000 917 917. Hello, good morning.
Hello, good morning.
Good morning. What's your name or where are you calling from?
I'm calling from.
What's your name?
Yes, I can hear you.
Yes, what is your name?
My name is Carol Chigo, calling from Mori.
All right. Your question for the doctor.
Yeah, I just put to bed, so and then I noticed that my stomach was protruding, as big, as if I'm 3 months pregnant.
Okay.
So what can I do so that my stomach can go down? Then second one is I have a 6-year-old child. So when he was 3 years, he's not stammering, but one day he just came back from school. So when he came back from school, I noticed that he started stammering. So till now he's still stammering. Is there anything that can cause it, or maybe I don't.
All right. Yes, Dr. Ajayi, do you have any question for her?
Okay, it sounds like two very different questions.
Yes.
You mentioned stomach being enlarged, and then the child stammering. Is that correct?
Yeah.
6-year-old stammering. Okay. All right, we'll take them.
All right, just so let's listen over the radio.
And how old is she? What's her age?
All right, how old are you? Hello. Oh, okay. I think we lost the call already.
That's fine. All right. So the first question, I believe she said after childbirth, she's noticed her belly is large or enlarged, and like I always say, I like to examine patients because I'm talking in general terms. But typically, after you gain weight during pregnancy, it's a lot of women find it hard to lose. And then, regardless of whether you're pregnant or not, as you get older, a lot of people find it harder to lose weight that they've gained. What we need to know is that as human beings, the body likes to store excess fat, especially in the abdomen or the belly area. We have sheets of fat there called omentum, and that's where the body likes to store fat. Most people response to having excess fat is they'll immediately stop eating or eat only one large meal a day instead of eating multiple meals a day, and that actually does exactly opposite of what you want. It makes your body's metabolism go very slow, and you can even pack on more fat. It tells your body that it may not see meals frequently, so your body will store fat as energy reserves. So that's what fat really is reserve of energy. So number one thing is have an examination by your doctor first. We have to make sure that abdominal swelling is not anything else besides just fat. Okay? I see patients that have abdominal swelling and it's other things, cancer, fluid in the belly, etc. So I don't want to be irresponsible when I'm talking. But once we have an exam and we think it's just fat, then we now start talking about dieting plans that will make your body burn fat calories faster than other calories. And there are different ways of achieving that by just modifying the times in which you eat and increasing the amounts of meals you eat, but reducing the size of those meals. So I can get into more specifics once I know the patient, and we often give meal plans to the patients. And if you're consistent with it, you'll see, because weight loss, 70% of weight loss is diet, and the other 30% is exercise. So even if you're not able to exercise that much, you can still do a lot by modifying your diet. So that's the fat, the belly fat question. The child stammering is a very different question. I believe the child was 6 years old, was not stammering before, and now started developing stammering. I think that's how she described it.
Yeah.
Which could be a multitude of issues. It could be anything from just lack of confidence and a social issue to an actual psychological issue. That child would need to be evaluated. There's actually a whole field of medicine dedicated to this called speech therapy or speech pathology.
Okay.
And we often work with them. So that kind of child would like to bring in and see whether or not this is an organic problem, meaning there's actually a problem with the brain itself, or this is something more of a behavioral problem, meaning an attitude or a lack of confidence or something else that can just be modified with reinforcement. There's treatments for both. Ideally, the sooner you start the treatment, the less you reinforce these negative behaviors. So sooner is always better for these kinds of things. If they need resources for speech therapists and speech pathologists, we can provide those with phone calls.
All right. Thank you very much, Dr. Ajayi, for that.
Sure.
And still talking on prostate cancer. What exactly is the cause?
Yes, we're always looking for the main cause of prostate cancer, and it's not clear. We don't know. All we know is that typically cancerous cells are caused by mutations or changes in our DNA. And if we know our DNA is like a code that produces our body cells, and our body cells are constantly growing and dying in cycles. For example, your nails are made of cells, and those continue to grow. You cut them or they die off and they continue to grow. Every cell in the body is like that, including prostate cells. So they're constantly being changed. So if that code is called DNA, if that code is damaged, then sometimes a trigger can be turned on where the cells are produced too quickly. And that's where you have cancer. And they now are produced so quickly that the organ gets too large, and sometimes those cells spread to areas close to that organ or further away, and infect other areas with the same kind of excessive cell growth. So the main things that can damage DNA, toxic chemicals, ultraviolet rays, X-rays. Those are things we call environmental exposure, and at times genetics. So we don't know the exact cause where we can say we're going to remove this, but we know what causes cancer in general. And then afterwards, we try and talk about risk factors and things that we can do to reduce the risk of becoming cancerous.
All right. Thank you very much, Dr. Ajayi. And I have this text message here. This is from WhatsApp message. This is from Bumi in Ogun State. It says, good morning, doctor. Is it good for a pregnant woman to continue breastfeeding?
Is it good for?
a pregnant woman to continue breastfeeding. So more like she has a baby, she's breastfeeding, then somehow along the line she discovers she's pregnant.
Okay, I wonder how old the child is. Does it have it?
No.
Okay. Typically it's safe. Okay. Typically we don't tell people to stop. If there was any issue, I would hope that she's seeing her doctor regularly. But to answer the question simply, it's safe. Generally, it's safe. There are some hormones that may end up in the breast milk, but they're usually not harmful to the child. So that's usually what you worry about. Some of the hormones of pregnancy going, entering the breast milk and going to the next child. But they're typically safe. So I've never had a patient in that situation where we tell them stop breastfeeding, unless maybe they're on some antibiotics or some other kind of medications that are not safe. Then we advise them not to.
Okay. All right. Thank you very much, Doctor. 07000 917 is the studio line to call to be a part of Radio Doctor this morning. It's 10:30, and I still have with me Dr. Abiola Ajayi. He is the MD CEO, ROA Specialist Hospital. And if you want to reach him outside of the studio, you can call 0705 919 2017, and he will address whatever health challenge that you might have. And this is from Sunday from Moe. Doctor, I am okay, more like I'm urinating regularly. I have gone to test. I've gone for a test, and the doctor found nothing. What is your advice?
They said urinating regularly? Is that what it said?
Yes.
Okay, and is male or female?
I think it's a male. Sunday from Moe.
Okay, and any age there?
No.
Okay. Well, Sunday's advice I would give you is to make an appointment to see somebody like me. That's the best advice. Men that one of the signs of we've been talking about prostate cancer, okay, but and one thing I neglected to note is that in some areas 1 in 5, in other areas 1 in 6. That's almost 20% of men will have prostate cancer in their lifetime. Okay. So, but besides prostate cancer, there's something called prostate disease, where you can have benign disease. That means the prostate is enlarged, but it's not cancerous, and that's quite common in men 60 years old. In some areas, 65% of men will have prostate disease, whether it's cancerous or not. And all of this cancer and prostate disease can cause increase in urination. So when I'm hearing that a doctor just did some tests, I don't know what tests they were and were they the correct tests and done under the correct conditions. So this is a person that we would need to see and make sure we've done the correct test, because that frequent urination may be a sign of something else. And if you catch these things early, you can have great success. If you wait and it's, God forbid, something more serious like cancer, and you wait until later to catch it, then the person's life expectancy can drop significantly. So to answer his question, we need to see, or at least talk and go over what was done and what was not done.
Okay.
All men from the age of 40 should be checking their prostate at least once a year.
Okay.
And then if there's any problem found, then we now check more frequently. Okay. And there are not many doctors that are actually qualified to treat prostate disease from start to finish. They're rare. The term is urologist, and there are not many in Nigeria. Typically, medical officers, gynecologists, which are really meant for just females. Other types of doctors are trying to fill in the gaps where they can't find urologists. But you really need to see a doctor that is well versed in prostate disease, so that nothing falls through the cracks and nothing is missed. Every day I meet patients that were misdiagnosed or diagnosed late, and they're suffering, and their family is suffering because of it. Because we now find cancer that has spread, and we now start talking about life expectancy in 5-year intervals instead of normal life expectancy. So need to be very careful about where we're going and what we're seeing.
Okay, so let's talk a little on the symptoms of prostate cancer.
Yeah, the main thing to note is that many people will not have any symptoms at all, especially at the beginning. And I get this all the time when we start doing blood tests, looking for some of the markers for prostate cancer, or that give us an idea of whether or not we should be looking. Sometimes I'll get values that are quite high, and first thing the patient will say is, "But I feel fine. I don't feel any differently than I do," and that's quite normal. So at times, most of the time, especially at the beginning, no symptoms, which is why we stress that from 40 on, we start testing, so that we can catch these asymptomatic patients. When things start getting more serious, you can start having nocturia, which is increased urination at night. You can have increased urination during the day. That's frequency. You can have difficulty urinating, meaning you're pressed, but you go to urinate and the urine doesn't flow. It just doesn't come, or it takes a long time to come. And occasionally people will have blood in the urine, but it's not as common as most would think. And pain is not as common as most would think, until it starts spreading. The people that I see that have pain with prostate cancer, the cancer has spread to the bones of the back, spread to the bones of the hip, and this is now advanced prostate cancer, and then they now start having pain. So a lot of the signs and symptoms are silent at the beginning, or they're insidious. Insidious meaning very slow, that you don't notice them until it's too late. So we still preach screening from age 40 yearly. That should be your birthday present.
All right. Thank you very much for that. And it's 24 minutes to 11 on Women Radio WFM 91.7. Let's get your questions across to the doctor. 7000 917 917 is a studio line to call in to ask your questions. And this can be in line with the topic we're discussing this morning, prostate cancer. And it can be that it's not in line with it, but it has to do with your health. Just call in and the doctor will address it. And you can send us a WhatsApp or a text message to 070 317 56537. I still have with me Dr. Abiola Ajayi. He is the MD CEO, ROA Specialist Hospital here in Arepo. And if you want to reach him outside of the studio, call 0705 919 2017. And I have this question here. Okay, the person's name isn't here. But please, when you're sending in your messages, your name and where you're sending it from is very important. This says, good morning, doctor. I am having pain on my left side lower abdomen. What could have been the cause, and what do you advise me do, please? I am, okay. She's calling, she sent this message from Ogun State, and she is 42 years old. Yes, doctor.
So left lower abdomen. Does she say how long she's been having it?
No.
No. Okay. And as a woman, so in a woman, anytime we have left lower, or even right lower, we think about ovarian cysts or ovarian something to do with the ovaries. That's typical. You could have something going on with your colon, which we call diverticulitis or diverticulosis, which is just like irritation of the colon or the large intestine.
Okay.
You can have appendicitis. It can affect on both sides. I know typically we feel it on the right side. Sometimes you
Mm.
feel it in the center. Sometimes you feel it in the middle of the lower abdomen. It can actually be felt on different sides during different stages. So I don't rule it out. I just put it lower on my list. So ideally, we should remember that pain is not normal. So if you're having consistent pain in your abdomen, it needs to be diagnosed. Okay, this is not something that you want to cover up with pain medication or not. And over the phone, over the radio, is I can just start naming diseases. But until it's diagnosed, meaning doctor puts his hands on you and does some exams, we may do some blood tests and/or scans, and then we need to give you an answer that okay, this is X, Y, or Z. Then you can know whether or not it's a benign disease, meaning a disease that's not cancerous, is something that we can just manage, maybe the symptoms, or this is something that we need to take very seriously. I
Mm.
had a patient like this last week. I think heard this radio program and ended up coming in, and they had been seeing a doctor since January with some kind of pain like that, and they'd just been going pain medication, this and that. By the time I examined, the belly was full of fluid, and to cut a long story short, the patient had ovarian cancer.
Mm.
So, and ovarian cancer is very, very, very serious. So where you may think is nothing, it could be something. I don't wish it is, but it's always good to get a proper diagnosis quickly so that we can have peace of mind and start treatment on time.
Mm. All right. Thank you very much, doctor. Hello, good morning.
Hello, good morning.
Good morning. What's your name and where are you calling from?
My name is Casey. I'm calling from Lagos.
Yes, Casey, your question for the doctor.
Yeah, my question is as regards to the prostate. For some time now that I used to have urination more than 5 times before I woke up, and I attributed it to the presence of drinking more water as I was advised by my doctor before. So I don't know if that one is a sign of the prostate cancer.
All right. Doctor, do you have any
How,
question for me?
how old are you?
Hello,
How old are you?
I'm 55.
Okay.
Okay, very good.
Do you have any question for him?
We'll talk about it.
All right.
No, not. Is he still having that waking up 5 times in the night? Is it still going on?
Is this still going until now?
Yeah, it is still going on up to now.
Oh,
But I thought that it is because I used to drink a lot of water.
okay. Yes, doctor.
No, that's all. You
right.
can listen on the radio.
Just do what to listen over the radio.
All right, I have another question.
Okay, go ahead.
My right ankle, I experience something making creak. I don't know why.
Okay.
Okay.
And I have a kind of growth in front of my, on top of my head.
All right.
Okay.
But the growth is not anymore. It's just like a boy.
All right. So, does he listen over the radio?
Thank you very much. Yeah.
All right, doctor.
Yeah, so this is a 55-year-old male with some multiple issues. I'll take them in order. Okay. The first one he talked about was frequent urination, but I noticed something with each of his issues, and I want to stress to people not to try and avoid this. Try to avoid making excuses or coming up with your own diagnosis. I know it's common. I know we all want to do it, but you have to resist that urge. Okay. Because I have a very, very close family member. You even know the person that even said something similar to this. Oh, I think it's just because I drink water. By the time I finished doing testing, I now found out that person is diabetic.
Mm.
So you don't. And if you treat diabetes early, patients can live a very long life, 100 to 100. My grandmother had diabetes; she died at 800. But if you do not treat these things on time, then you can now start having issues, blindness. Some people have amputation of their limbs. You know what I'm saying? So you really don't make excuses. Get in front of a proper doctor and let's do diagnosis. A 55-year-old man should have had his prostate checked 15 times by now, and it doesn't sound like he's had that. So, and we know that prostate disease is a sign of, frequent urination is a symptom of prostate disease, whether it's prostate cancer or not. It could also be urinary tract infection. It could also be increased blood sugar from diabetes. But we need to know the difference. So we need to be examined for all of those things.
Okay.
And I've always said, if you don't feel the doctor is giving you all these answers, then you need to change, get another opinion. Second, it's your body, it's your right to get second opinions. I send patients for second and third opinions all the time. I freely do, because at the end of the day, that patient should feel comfortable. So that frequent urination, we need to make sure it's not prostate disease that's causing it. Because that's often the first thing that people will notice, is that they're waking up in the night. Anything more than 1 to 2 times a night with a younger man and 2 to 3 times a night with an older man is significant. So 5 times is extremely significant. The next thing he mentioned was a crackling noise in his right ankle. That's called crepitus, and typically is caused by damage in the ankle, whether it's from cartilage damage or an injury of some sort. So that ankle will have to be imaged, meaning we'll take pictures, whether it's with an MRI or an X-ray, and then we fix the problem. Basically, if it's a bone, you can shave off the bone. If it's cartilage, you can actually clean out the excess cartilage and return it. Otherwise, it's just going to continue making noise and eventually cause pain down the road and what you call arthritis.
All right.
The third one, he also gave his own diagnosis for it and said it was a boil. That's the growth on the head. Cannot be sure about that until we see. Okay, a boil is typically an infection, that has now grown pus inside, but it could be a lipoma. Lipoma is a tumor of fat. It could be hematoma, which is a growth that's full of blood. It could be anything. So until it is properly
diagnosed,
biopsied and checked, we won't know exactly what it is. And any growth is abnormal, so therefore it should be checked out, examined. I typically like to remove growths and have them examined afterwards. So. That's my advice for this gentleman.
All right. Thank you very much. 13 minutes to 11 on Women Radio WFM 91.7. Let's get your questions on 07000 917 917. Send us a WhatsApp or a text message on 070 317 56537. I still have with me Dr. Abiola Ajayi. He is the MD CEO, ROA Specialist Hospital. And if you want to reach him outside of the studio, call 0705 919 2017. Now, before we call the program to a wrap, how can prostate cancer be prevented, and what is the treatment measures available?
You said prevented, correct?
Yes.
Yeah, there's a lot of different ideas out. We don't have a single way of just preventing it. The ideal strategy is routine screening, which I've been repeating like a broken record. Screening meaning testing from age 40 by a qualified physician.
Okay.
Of course, we've seen that those that reduce the risk factors can delay or prevent prostate cancer. So let's talk about some risk factors very quickly. Some of them are age. Okay. You can't prevent your age, but you can screen when appropriate. From 40, do it yearly. Don't skip any years. Race, meaning those of us that are darker skin typically have more of it. Know your family history. If anybody in the family has any hormonal cancer, before we used to just look for prostate cancer in your father, uncles, and grandparents, but now we know that it's also related to hormonal cancers like breast cancer, thyroid cancer, ovarian. Anybody in the family that has any of those cancers can now cause you to have a higher risk of these cancers. So know your family history, and make sure your doctor is aware. So at times, if I have strong family history, for example, I have a group of sisters that I'm treated one for breast cancer. Now that I know they have a strong family history, 3 of them showed it. The other ones we were testing from age 35 instead of waiting to age 40.
Mm.
And then know what you're exposed to, whether you're at work. If you work with chemicals, you need to know what chemicals have protective gear. And then the final thing is a balanced diet. Eating diets that have that are organic actually have cancer killing compounds in them. And then there's some different vitamins and minerals that actually have been shown over time to reduce risk. And some of those are found in tomatoes and found in different categories. I don't think we have time to go through them now, but if anybody calls, I'll try and send a list or put it up on the website of some of the compounds that you can find in naturally occurring foods that can reduce your cancer risk as well as prostate cancer risk. So the main thing centers around reducing risk factors
All right.
for prevention of prostate cancer.
Mm. So what is the treatment measure, that are available for prostate cancer?
You have many treatments. You have many treatment options. I was lucky enough to go to visit some government hospitals last month, and I was happy to see that they're starting to have some wings dedicated to the treatment of cancer, including prostate cancer.
Okay.
It depends on the stage. For example, if we catch it where it is still just in the prostate, in this portion of the prostate, we can even do something called a radical surgery, where you cut out the entire prostate and tissue surrounding it, and you have now cured the cancer because you've removed all of it. But that's at the early stages. If we now find out the cancer has spread to the areas surrounding the prostate, then we can do things like radiation, which will reduce the cancerous cells in the pelvis, and then now also do hormonal treatment. So I treat prostate cancer with everything from injections that people take every 3 months
Okay.
to surgery where we try and remove the prostate, or different surgeries where we try and reduce hormones. Because prostate cancer is a hormonal responsive cancer, meaning high levels of testosterone will make prostate cancer grow. So if we can reduce testosterone, we can reduce the growth of the cancer. And all of these things are ways of managing prostate cancer instead of curing it. Because once it starts spreading, it's difficult to cure. You can't go and cut it out of all the bones if it starts spreading to bones. That's why it still come back in stress, early screening. But if I do get people in the late stages, depending on where it is, we can do hormonal treatment, injections, and/or surgery. And then we now combine that with radiation, and you can get some good results. There's even a few people that we do something called brachytherapy, which is injection of radioactive pellets. They're like little grains of rice, and they are radioactive. We put them into prostate, and it kills the cancer from the inside. We have great results. With that. I typically send them to our hospital in the U.S. for that, but I'm happy to know that fairly soon we'll be able to do that in Nigeria. So there are a lot of treatment options available.
All right. Thank you very much. Thank you so much. What will be your final words on the discussions we've had this morning, Doctor?
The final word, especially on this topic, is something that I see often with us when we have issues. We tend to try and ignore them. Please do not ignore any symptoms. If you have pain is not normal. If you have bleeding is not normal. If you have something growing someplace, it's not normal. And as much as you are afraid to get a bill from a doctor or get bad news from a doctor, I promise you, the earlier you get started, the better and the cheaper it's going to be in almost every single case. So the longer we try and put things off, you're just going to end up with something far more serious at the end of the day. So just encourage people, if they have any symptoms or have any issues, to come and get checked out. And then let's not be the culture that waits until we have problems. We're supposed to be having well checkups once a year. Children are supposed to be checked by their pediatrician once a year. And there's no reason why children should be checked by pediatricians and adults should not have a checkup once a year. It's going to save you money in the long run. Save your health and your loved ones in the long run.
Thank you so much. Thank you very much, Dr. Ajayi, for joining us again this morning.
It's my pleasure.
All right. Do enjoy the rest of your day.
Same to you.
And yes, that was Dr. Abiola Ajayi. He is the MD CEO, ROA Specialist Hospital, and here in Arepo. If you want to reach him outside of the studio, you can call 0705 919 2017. 0705 919 2017. We have come to the end of Radio Doctor. Thank you for your contributions. Thank you for calling in and asking your questions this morning. Yes, sorry, we couldn't take all of the text messages. I saw some messages coming in and the phone line buzzing. But yes, we can't take any more calls. But you can call in on Monday, and definitely there'll be a doctor in the studio to address whatever health challenge that you might have. Please stay safe. COVID-19 is still real, and make sure you observe all of the precautionary measures so we don't spread, but rather begin to stem, the spread of this virus. I am Bukola Balogun. Thank you to the producer, Daniel Adaja. And yes, like I would always say, please make life bearable for the next person by you. I am Bukola Balogun. Good morning.
To sponsor this program, please call 080-9058-2769.
My better people better don't land. Ives Medicare HMO now one of that ogbonge health maintenance organization where our government stamp gidigba for health insurance matter. My country people, why you go sick before you cover yourself? What if money no dey when you fall sick? Ives Medicare